The Thera PEP is a positive expiratory pressure device used to assist with chronic sputum retention and lung ventilation. It is for single patient use only. It should be prescribed by a healthcare professional trained in the use of this device. The Thera PEP consists of 5 pieces: the expiratory pressure indicator for visual feedback of expiratory pressures, plastic tubing connecting the device to the pressure indicator, a valved resistor with a pressure dial, a mouthpiece, and an adapter. Assemble the device by attaching the mouthpiece to the adapter and the adapter to the resistor, ensuring that the arrow points towards the mouth. Connect the plastic tubing to the resistor and to the pressure indicator. If bronchodilators have been prescribed, administer them before commencing treatment with this device. Set the resistor dial so that the appropriate number is opposite the arrow. During the teaching session, this setting will be adjusted to provide a positive expiratory pressure of 10 to 20 centimetres of water pressure between the 2 black arrows with good expiratory flow. Sit with the elbows supported with a neutral lumbar spine and the shoulders and neck relaxed. Make a tight seal around the mouthpiece with the mouth. Breathe in with a slightly larger than normal breath, relaxing the neck and shoulders as much as possible. Breathe out actively but not forcefully through the mouthpiece with no airflow through the nose. A nose clip may be required for the initial training of this device. During the breath out, keep the top of the blue marker between the lines on the pressure indicator. If the blue marker does not sit between the 2 black arrows, either the breathing technique or the pressure dial may need adjusting until appropriate pressures are achieved with good expiratory flow. Repeat for 5 to 10 breaths depending on the clinical symptoms. Remove the mouthpiece and breathe quietly for a few breaths. This is 1 cycle. The physiotherapist will prescribe the appropriate number of breaths and cycles depending on the clinical symptoms. When using this device for airway clearance, huff as instructed by the physiotherapist, either at the end of each cycle or at the completion of all of the cycles. This should be individualised to the patient's needs. If prescribed, a nebulizer may be attached to the Thera PEP by connecting the small volume nebulizer T-piece to the end of the device. Seal the mouth around the mouthpiece and breathe in through the mouth as previously described. After each session, remove the mouthpiece and wash it in warm soapy water. At least once a week, wash all of the pieces as per the manufacturer's instructions. The patient should be given written instructions including the technique, prescription and cleaning of the device.